Hi everyone, welcome back to my channel, Semi-Retired in Japan. Today, I want to talk about something that really matters to me, healthcare. Specifically, I'll be sharing my experience navigating the medical systems in both the United States and Japan as someone raising a young child and supporting a husband who lives with ulcerative colitis. UC. I will break it down into 3 key areas. Number 1, insurance premiums. Number 2, support for chronic conditions like UC. Finally, number 3, healthcare access for children. Let's dive in. Number 1, insurance premiums. When I lived in the US, I was enrolled in a family health insurance plan through my employer. I paid around $600 per month, which was 20% of the total premium. The rest was covered by my company. The plan covered me, my husband, and my child. Even with insurance, I still had to deal with deductibles, co-pays, and unpredictable out-of-pocket expenses. Every visit felt like a financial decision. In Japan, the structure is completely different. I pay around 30,000 yen, which is about $200 per month for social health insurance, which also covers my family. I pay 50% and my company covers 50% of the premium. The system is more predictable and I am never hesitant to seek care. At the point of service, I usually pay 30% of the total cost. Number 2, chronic conditions, costs, and support. In the US, my husband was receiving biologic medication to manage his UC. Thankfully, a co-pay assistance program reduced our out-of-pocket cost to about $100 per month. But the process wasn't simple. Every year, or sometimes every other year, we had to go through pre-authorization process, which meant reapplying, submitting documentations, waiting for approvals, and constantly worrying about coverage interruptions. It was stressful and emotionally draining, especially for a chronic condition. In Japan, UC is designated as a nanbyo, an intractable disease, which makes me eligible for government support. With the Tokute Iryohi Jukyusha, an intractable disease certificate, his total out-of-pocket medical costs, including medications, tests, treatment, and even surgery, is capped. In his case, at about 10,000 yen, which is around $70 per month. While applying for this program does involve lots of paperwork and waiting, forms from the doctor, income documentation, visits to City Hall. But in our experience, it's worth it. The process is well supported. Hospital staff and city officials are familiar with the requirements and genuinely helpful. Once approved, the financial relief and stability it brings are huge. Number 3, healthcare for children. In the US, taking care of a sick baby often felt overwhelming. I had to rely on thermometers, over-the-counter medications, and my own judgment before deciding whether to seek professional help, because urgent care or ER visits were expensive. I remember paying $160 for a 10-minute online urgent care consultation just to speak to a doctor briefly, and honestly, it wasn't that helpful. I left feeling unsure and unsupported. For ER, we paid around $450. In Japan, it's a completely different experience. With the Iryosho, a certificate for a child, I pay nothing for doctor's visits, medication, or hospital treatment. I never have to hesitate when my child has a fever or a cough. I can take him to a pediatrician or hospital right away without worrying about the cost. There's a sense of peace in knowing my child has access to care, not just when it's serious enough, but whenever it's needed. I believe that both systems have their strengths and weaknesses. In the US, I appreciated the innovation, but the financial pressure was intense, especially with a chronic illness in the family and a growing child. In Japan, while the system can involve more paperwork and waiting, the care is consistent, affordable, and family-friendly. I don't have to make medical decisions based on my wallet, and that, to me, is a huge relief. If you're living with a chronic condition in your family or raising a child, I hope my story gives you some insight and maybe some peace of mind. Thanks for watching. If you found this helpful, please like, subscribe, and feel free to share your experience in the comments below. Thank you. またね。